Hello, my name is Scott Lang, and I'm a registered radiologic technologist, which is just a fancy way of saying I'm an X-ray tech. I would like to speak with you today in regards to radiation protection during an X-ray examination. This way, the next time you have an X-ray procedure, you'll know how to protect yourself in regards to unnecessary radiation exposure. So how many people here have had an X-ray? I have. I dislocated my finger playing basketball. And apparently we're not alone, because according to Ludwig Boss, the author of Medical and Computenetics 5, Boss states approximately 2 billion x-rays are taken in the United States each year. And that's a lot of x-rays. By the way, what is an x-ray? Anyone know? Well, to keep it simple, an X-ray is radiation, and radiation can cause health risks such as cataracts, blood disorders, birth defects, and even various forms of cancer. As a diagnostic imaging professional, I have a responsibility to ensure radiation safety during all X-ray exams. In the book, Radiation Protection in Medical Radiography, radiation protection is defined as effective measures employed by radiation workers to safeguard patients from unnecessary radiation exposure. One of the responsibilities for radiation protection is that the benefits of the X-ray outweigh the risk of being exposed to radiation. The X-ray tech and radiologist share in keeping patient exposure at the lowest level possible. This can be achieved by using the smallest radiation exposure that will produce optimal X-rays. This is known as the ALERA concept, which is an acronym for as low as reasonably achievable. Also, if a patient receives an unclear explanation from a doctor about the benefits of an X-ray exam, they can refuse treatment based on the patient's Bill of Rights, which was adopted by the American Hospital Association in 1973. The basic principles of radiation protection are these three factors: 1, time; 2, distance; and 3, shielding. Time reduces the time of an exposure, reduces the effective dose proportionately. This factor goes back to the X-ray tech and the ALERA concept that we spoke about just seconds ago. And 2 is distance. Increasing distance reduces the dose of the X-ray. Most X-ray examinations are performed at 40 inches or 72 inches to obtain optimal X-rays. And the third factor is shielding. Gonadal shielding devices are used during X-ray procedures to protect the reproductive organs, because they are one of the most important, most radiosensitive organs in the body. Gonadal shielding should always be used, and it's something the patient can control to make sure that they have it. In Principles of Radiographic Imaging by Carlton states that a female reproductive organs receive 3 times the amount of male that a male does. But by using gonadal shielding, it can reduce exposure by 50%, which is half in females, and up to 95% in males. This could prevent testicular cancer, ovarian cancer, and even sterility. I know it doesn't make an incredible fashion statement, but if you take one thing away from this speech, please make sure that you're wearing this when you have an X-ray. Maybe the X-ray tech forgot to put it in your lap. Ask for it. Put it on you. It really could save your life. I would like to go over some of the things we spoke about earlier. The ALERA concept was 1, which is to keep the exposures as low as possible to obtain optimal X-rays. 2, risk versus benefit. The benefits have to outweigh the risk of exposure, radiation exposure. And the third is the 3 factors of time, distance, and shielding. Thank you very much. I know this is a lot of information in a short period of time, but if anybody has any questions, please send me an email at the number 5lang, L-A-N-G, @cox.net. Thank you very much for your time, and have a great day.